Das war ja durch eine simple Blutuntersuchung.
It was actually because of a basic blood test I had to do for my workplace. I worked in the post office and they do it on a regular basis. So I went to my general practitioner and she threw up her hands in terror because the results were already so bad that I had to go to the kidney outpatients clinic straight away. And then it went on for almost a year, during which time I also had to choose what type of dialysis I should have.
Was für eine Form der Dialyse ich machen sollte. Ja, 2016.
And in 2016, my kidney failed completely. And that's when I decided to do peritoneal dialysis first. But that didn't work so well. It didn't detoxify my body that much.
Entgiftet. Und dann bin ich dann zu der klassischen Hemodialyse gekommen.
So I've been receiving standard hemodialysis since 2017. Actually, my physician thought it wouldn't be a bad idea if I could also do dialysis with needle puncture at home. It didn't work, and because of that, I've now switched to normal dialysis, and that's fine for me.
Und das ist in Ordnung für mich.
I still can't even look when they're putting the needle in.
Die mich da punktieren.
We've been married for 43 years now, so we obviously know each other quite well. So he's actually the more laid-back one.
Eher der ruhigere Part.
I was always the energetic one before, but I've become a little more laid-back. If I'm completely honest, I've become a couch potato.
Ich bin da eine faule Socke geworden, also muss ich ganz ehrlich sagen.
At first, I was a bit afraid about needles 3 times a week, because I knew they were also thicker needles.
Nadeln sind, ne? Und da hat man schon Respekt davor.
Yes, but there are also things you can do, like you can put ointment on, so it doesn't hurt as much when the needle goes in.
Ne? Und wie gesagt, man muss halt, wenn der Shunt, der wird ja dann operiert.
When a shunt is used, it's inserted by a surgery, and you have to be trained first, so you can be punctured at all.
Also es ist ja auch nicht nur das Punktieren.
So it's not just the puncturing, it's also when the machine starts making alarms. If there's something wrong with the shunt, it can sometimes happen that the needle sucks up something on the wall and clogs up. Because of that, I feel better if someone professional is there who can watch.
Wenn jemand Professionelles da ist und gucken kann.
You actually have a room you always regularly use. There are even 5 other patients there, and everyone already knows each other. And like I said, the staff are great. They're all so nice and care for you and do everything.
Die sind alles sehr nett und kümmern sich und machen und tun. Also ich fahre 3-mal die Woche.
So I drive 3 times a week to my dialysis centre. I travel there Mondays, Wednesdays and Fridays.
Ich fahre selber.
I drive myself. A lot of people do get there by taxi. They go by taxi, but as long as I'm still feeling fit and healthy, I drive myself. By the time you're hooked up, it's usually just after 7.
So kurz nach 7.
Then you're normally on dialysis for 4 hours, 4.5 hours, just dialysis.
4,5 Stunden an der Dialyse, reine Dialysezeit.
Then it's usually 12:30, between 12:30 and 1, depending on when you're hooked up, when I'm back home.
Dann wieder zu Hause.
By that time, my husband will have cooked something, and then I usually have to lie down on the sofa first. Especially after the weekend, you feel very tired. At least I am. You first have to give it an hour and a half, 2 hours, then you can think of what to do next. We either go for a walk, or like I said, we read a lot.
Entweder geht man raus spazieren, oder wie gesagt, wir lesen sehr viel.
A good day is when I've slept the whole night beforehand.
Geschlafen habe, ne? Weil das ist halt, dass ich halt.
That's just because I can't sleep through the night anymore. When you hear the shunt, because it does vibrate inside, it buzzes. And when you put your arm next to your ear, it's very unpleasant.
Da muss man.
You have to sort of place your arm in a different position, and then you can go back to sleep. In the end, it was my decision, but my husband also fully supports me. It was the same back when he donated his kidney to me.
Das war ja damals auch so, dass mir seine Niere gespendet hatte.
That was no issue at all for him.
Gar kein Thema.
But you have to make the final decision yourself. It's the only way to do it.
Das geht gar nicht anders.
You can't just say, well, I'll try it now, and then say you don't like it and try something else. It doesn't work like that, because when you have a shunt, it has to be inserted, and it also has to mature first. Even with peritoneal dialysis, the catheter also has to be implanted first. It's a decision you should think long and hard about.
Das ist schon eine Entscheidung, wo man länger überlegen sollte.
So at the moment, things are going well for me, as they are.
So wie es ist.
Whether I should still try something else in the future, I don't know.
Was machen sollte, weiß ich nicht. Also die haben auch schon.
They've already asked if I want to be put on the transplantation list again, but it's not something I'm bothered about at the moment.
Kein Thema von.
The issue is that everyone is different. You can't make any general statements about what's better for you or someone else. You have to figure that out yourself.
Das musst du mit dir ausmachen.